everyone, this is Reassure Caroline and today I'm here with Reassure. We are from Langford International Academy. So we're back with another role play. So today we'll be looking into a case where our patient is a 60-year-old woman. So she was admitted at the hospital for the treatment of acute kidney injury. The thing is, she wants an early discharge, but she's not ready for it. Like, her condition is not yet recovered. So the nurse has to try to convince her to be at the hospital. So here, Tanisha will be handling the part of the patient and I'll be handling the part of the nurse. So let's get started.
Langford International Academy. Your passport to the world of opportunities.
This is your cue card.
All right.
And you have 3 minutes to prepare.
Okay.
Are you ready?
Yes. May I know the name of the patient, please?
You can call me Miss Emily.
Okay.
Dinner time starts now.
Good morning, Miss Emily.
Good morning.
How are you feeling today?
I feel quite better and I really need to go home today. Is that possible?
I'm so happy to know that you're feeling better. However, the doctor hasn't decided yet to discharge you. But I can see that you're worried about something. So could you please tell me why you asked for an early discharge?
My husband is unwell. He's got Alzheimer's. And I am his primary carer.
Okay.
And I really need to go home as soon as possible because of that.
See, I'm so sorry to learn about your husband, and I understand that you're really worried about thinking about his well-being in your absence too. However, given your condition, it is important that you stay in the hospital for a few more days because we have been giving you fluids and you need more fluids too. And also we have given you blood for a couple of tests and we're awaiting the result. So once we have the result, we will discuss with the doctor and then we can decide about your discharge. Is that clear for you?
I really understand what you're trying to say, but I've left with no other options. I must go home today. Can I discharge myself? Is that possible?
See, I understand this is emotionally upsetting you and you're considering a self-discharge. However, I won't recommend that, because there are possibilities you might get some infections and other complications. So I'll tell you the possible complications if it is not taken really good care. It can even cause bladder damage or kidney failure. And we really don't want you to go through all these complications. That's the reason why we are requesting you to continue the hospital stay. However, I do understand you are worried about your husband and you're thinking that in your absence he will not be doing fine. But can you think about some other alternatives, like maybe any of your family members or your friends can take care of him?
Well, I think if asked, my son would be probably be ready to take care of my husband for a few days.
Well, that sounds good. So I hope that you can give him a call and check with him. Will that be okay with you?
Yeah, I'll
All
try.
right. And I reassure you that you don't worry about your discharge, okay? You will be discharged as soon as possible if everything is fine. If you don't have any complications and if your blood test results are also doing normal, then yes, we will consider your discharge. And I think you don't need any lengthy stay at the hospital too. So do you have any other concerns?
Yes, I'm really concerned about getting admitted in the hospital again. I really don't want that to happen, especially under these circumstances.
That's a reasonable query, and I understand that you are concerned about coming back to the hospital again. Well, if you take care of few things, especially about how you take care of yourself, then you do not have to come for another admission here. So if you don't mind, I can explain few self-care measures. Will that be okay?
Please.
All right. So in this condition, it is very important that you take really good care of you, especially you need to stay hydrated most of the time. So you need to increase the intake of fluid, okay? Along with that, it is equally important that you take a well-balanced diet. So if you're concerned about what is a proper diet for you, I can have a word with a hospital dietitian to meet you. So he will be able to guide you on what is appropriate diet. So do you want me to book an appointment with the hospital dietitian?
Yeah, definitely.
I'll do that. And after your discharge, self-discharge also, it will be good if you can consider respite care for your husband, because you also need rest, and we don't want you to strain and struggle so much. So it will be good if you can consider that too. Okay. And I understand you might experience slight pain. However, please do not take any unprescribed painkillers. If at all you feel any discomfort, always reach out to us, and after consulting the doctor you can decide on the medication as well. Okay? Please don't take anything unprescribed. Okay, so if you follow all these things, then I think there won't be any necessity of coming back to the hospital. Okay, so do you have any other concerns, Miss Emily?
Not really.
Alright, so I hope I have clarified everything for you, and I do understand that you're really concerned about your husband. Please don't be bothered so much about it. I do totally get it. However, there are certain alternatives as we have discussed, so I hope you'll make a call to your son and make the arrangements for that. Okay,
sure.
So in the meantime, if at all you require any extra help, please feel free to raise it to us. Okay, so you please take rest here. I will let you know when our blood test is back, and after that the doctor will come and meet you and discuss further details. Okay, so is there anything else I can do for you?
No.
Alright, so Miss Emily, please take rest here. I'll be at the nursing station if at all you need me. Okay? So thank you so much for your time.
Thank you. So that's the end of our role play.
Alright. Well, that was the end of the role play, and I hope it was clear for you guys. So we explained how you can convince a patient who is asking for an early discharge. However, we request the patient to stay at the hospital for the patient's betterment. So I hope everything was clear throughout the role play. If yes, let us know in the comment section. So Dhanush and I will be coming back with more videos very soon. Until then, take care. Bye-bye.
Bye.